trying out Botox on her. So Lauren, tell me exactly what concerns you.
I feel like I always look very exhausted. The lines around my eyes, makeup gets caught in the lines and it creases. And also I've been noticing that I have lines right here and lines on my forehead.
Can you raise your forehead for me? Wonderful. Okay, so Lauren is my typical patient that comes here for Botox injections, essentially complaining of looking tired. I have Botox in my face. I have deep crow's feet lines and deep forehead lines that when I don't have Botox in, I look very tired. So on Lauren, we can see, squint for me. She has lines around the eyes here. Raise your forehead. She's got forehead lines and a frown in between the lines here. Great, now relax your face. You can see she's starting to create some permanent lines already. And the reason for that is she's making the movement on her face. And it's like, I explain to my patients, it's like when you crease paper and then you relax the paper, you still have a little fold in there. So what the Botox will do is just try to relax the muscles and stop you from creasing your skin and permanently creating those lines. So I will do for Lauren today, what we're going to do is about, I'm going to do 15 units of Botox on your forehead. I'm going to do 20 units in between your eyes, and I'm going to do about 7.5 and 7.5 units over here. The Botox I've already drawn out. I have little syringes that come with 10 units in each syringe already. I'm having Lauren ice while we're doing before we do the procedure, just to make it more comfortable for her. And we do little sticks on the sides over here. I'm going to wipe with a little alcohol swab just before I do the procedure. Okay, so I'm just going to get set up and we're going to do it. Any questions for me before we do it?
Yes. Can I resume normal activity right after this?
Yes, you can.
Okay, so I can go to a spin class, I can work out, everything is okay?
I suggest no gym.
That I have to be concerned about?
There's nothing specific you have to do. You can wash your face as normal, you can put makeup on as normal. I just suggest no gym for 24 hours. And Lauren was already prepared before she came in to avoid any aspirin or aspirin type products for a few days, avoid any alcohol for about 24 hours. And what that does is minimize her risk of bruising and after the procedure, which we've done, which we've spoken about. Okay. I like doing ice packs. It just makes the procedure a little more comfortable, though you'll see how quick it is when we do it, okay? Any other questions?
That's it.
Great. So I've already had her, I've already taken her before pictures, and I've already had her sign her permission forms for the procedure. Great. So here we go. So we're going to start around your eyes, okay?
Okay. I'll use the distractor to distract me.
Great. So just rest your head back for me. Smile big. Right, relax. So when we do the Botox around the eyes, there's two ways I can do this. I can do it so that we get a little brow lift. On her situation, we're not going to do that because she doesn't need, her brows are in great position here. So I'm going to stay a little lower with the Botox. Her lines do extend underneath the eyelid over there. So I will do little micro droplets over there too. Here we go. Just alcohol swab. Close your eyes. Just keep them closed for a second. I don't want to sting your eyes. Okay, here we go. You can press the distractor there. Pinch. So 3. And I'm going to do 2 little ones just closer to the lower eyelid over there. All right, Lauren, that's to get the crepiness under the eyes there, okay? So why don't you open your eyes and just look up for me. So it'll be 2, 1, 2, okay? Great. You all right?
I'm good.
Great. Turn your head this way.
Close.
Yep, close your eyes, fine. And then just 3 more little ones over there. Okay, now we're going to get a little closer to the lower lid here.
Okay.
So look up for me again. So 2 little ones right here. Okay? And once again, this is because she is very thin And she's starting with some crepiness under the eyes. Lauren's actually going to come back and do her CO2 laser micro peel with us in about 2 weeks. So I like to schedule the micro peels after the Botox, because once the Botox is in, the face is nice and flat. So when you heal from the laser skin resurfacing, you heal with fewer lines. You can see she doesn't have any tiny little red spots, but otherwise you can't tell we've done anything. All right. Now we're going to go on the forehead. Raise your forehead for me.
Sure.
Okay, relax. Turn your head towards me. So with the forehead, I don't like to go low with the Botox because there's always a risk of dropping the forehead. So I'm going to go 1, 2, 3, 4 little shots here. Raise your forehead again. Okay, relax. And what we'll do is we'll have Lauren come back in 2 weeks so you can see her after effects. Or what we'll actually do is just post her before and after pictures. I like to pinch the skin with my other hand here. So there's a little air bubble in this, so I'm just going to get that out. Great. Little spots, and now we're going to do the Botox between her eyes in the glabella. You doing okay?
I'm good.
Great. So these little bumps are going to go away within the next 20 minutes. Been okay?
Everything's great.
Great, great, great. Now I want to go a little lower with these bunny lines over here.
Okay.
So I got a little bit more Botox here for you.
Okay.
And then we're almost done. And I'm just going to finish off a little bit more here, then we're done.
Okay.
That's it for the Botox. I'm going to give Lauren a mirror here just so she can see what we've done. Lauren, just hold right in there for me.
Yeah.
I can take the distractor from you.
Okay.
You don't really have to ice or anything because it's done unless you're having
Great.
any discomfort.
No, all good.
Here is your mirror.
Thank you. Perfect.
Okay,
Wow.
so these little dots are going to go. You have a little bleeding there, but you can just hold pressure
Yeah.
there.
Okay.
And you can see even around the eyes. So, you can go and put some touch-up makeup if you
Yeah,
want right now. Even though I did it under the eyes, you can see she has no swelling from that. And I've already told Lauren the Botox will take a couple days to kick in, and in 2 weeks you'll see the full effects.
Great.
So we'll have a follow-up with her in 2 weeks, and you can see how she's doing. Thank you very much.
Thank you.